Disc pathology, disc herniations, pinched nerves, sciatica, all words for the same thing. This happens in many, many people, but it's relatively uncommon in pediatric patients. A young patient has a disc herniation and is managed for a year by physicians who tell him, oh, you're too young to have this problem, you're too young for surgery. He's not too young for the problem he has a big disc herniation, sciatic pain and back pain that now he can't play sports. Well, you don't run a patient like this around town and tell him there's nothing that can be done and leave him to never play sports again. That's not what orthopedics is. Orthopedics is return to function, and that's what we're going to do for this young man today. How do you fix it? Endoscopic microdiscectomy. Small incision, quick recovery, get him back to sports and get him back to his life. Get the pain so that he can return to function. First step is x-ray. Second step is numbing things up. This keeps bleeding to a minimum during surgery, but also keeps people much more comfortable after surgery. Small incision. Now creating a path for the surgery here. Now making sure I know exactly where I am, and that's where x-ray comes in. And now ready to put the scope in. There we go. You know, with kids, I mean, many people think that, oh, you're too young for spine surgery. This isn't a spinal fusion, first of all. It's not a multi-level. You know, there are a lot of things that you don't want to do in kids, but microdiscectomy for, you know, sciatica and back pain, he should wake up in the recovery room and go, it's gone, I'm better. We're starting to see the ligamentum flavum, which is the white material there. So taking just a little bit of muscular tissue, which is the pink right there, will not be noticed, and getting under it just a little bit to get to the ligamentum flavum. So flavum will be under this layer right here. Usually you can see the fat right there. That usually kind of layers on top of it. Typically with my discectomies, it's, I don't know, 1 to 3 weeks of downtime or needing to take pain medicine post-op. With this, it's a day or two, usually Tylenol and Motrin. So that's kind of the reality of this kid. He was, you know, passed along, lost a year of his life athletically for no reason. Now you see that yellow material right there in the center of the screen? That's your ligamentum flavum. So that's going to be the entry into the spinal canal. I don't have to take any bone. That's the beauty of this procedure. This is the facet area right here, and the bone of the lamina laterally. And this is going up underneath the lamina here. So this flavum to about this level is what I'm going to take right here in small little bites. And then, of course, stopping all bleeding is of paramount importance as we go through here, because it interferes with visualization once we get into the spinal canal. No hurry to get in, just a lay at a time. See epidural fat right here, and then the beauty is the irrigation from the scope pushes all that away, so it minimizes any risk of getting into the nerves or damaging the dura. So now that I have a visible entry, I just keep working this ligament lateral and distal, so then I can get absolutely lateral to the dura. To the left on the screen is going to be the sacrum, or the sacral lamina. At 6 o'clock here is going to be lateral. At 12 o'clock it's going to be medial, so the spinal canal is going to be this direction. The epidural space is right there. So now this is just a traditional spine surgery instrument, so then I can work my way lateral to the nerves. Once I get out there, free things up, then I can attack the disc herniation. So you can see right in the center of the screen, directly beneath my instrument, the nerve root, and I just want to make certain that it's completely free. Then I can safely get this nerve decompressed and get the disc herniation off the nerve. So now I'll grab this epidural fat right here and expose the axilla of the root. So I'm lateral now officially to the S1 root right here. Get a little bit more of this ligamentum flavum. Disc herniation is just like a ligament sprain, basically. So, you know, you tear the ligament that contains the disc, and then you get a herniation. And I think that's probably what happened to this young man. So again, working lateral. This is now lateral to the root. And you can see that white material right there. That's the disc herniation. So next part of the step is just advance this cannula in here into the spinal canal. Now I'll turn it, rotate it, and it will retract the nerve root. So now I can look right at the disc herniation right here. So now we'll cut the annulus. You can see the disc already wanting to come out. And that's why we're here, is to get this out of here. So you can see the disc coming out is when it's put off this long, this disc material just all scars in. So it's a lot easier to take care of these when they're in that 3 to 6 month range, as opposed to waiting a year. They oftentimes will come out as one piece when they're fresh like that.
Here you don't have like endoscopic
There's a big piece. So you can see I've got the root where I can see it, just kind of reaching to the midline where this disc herniation goes. Again, that's annulus and spinal canal right there. See the nerve root right up above me. You can see all this disc, which is trapped and scarred right under that annulus, right under that root. So everybody's next natural question is, when are you done? So whenever I get this. So I think a pretty straightforward discectomy surgery. Again, the only downside is that putting it off this long, there's a lot of scar, so the disc doesn't come out in one fell swoop. It takes a lot of work to get all that material out and then the pressure off of the nerves. All right, dilator, PRP. So we're done. In recovery, my hope is he's going to notice a difference. He's going to notice that his leg pain is better, that his back pain is better, and he really should be back to fairly normal activities. Ultimately, he should be able to get to contact sports, and hopefully he can win a state championship.